Hello, everyone. Good morning, good afternoon, good evening from wherever you are joining us in the world today. And welcome to another episode of the Realist Lens for researchers who keep it real. In this episode, we turn our attention to health systems research in marginalized and ecologically sensitive contexts. We'll unpack how realist approaches can move us beyond level program assessments to reveal the deeper structures and mechanisms that shape health outcomes, especially for Indigenous communities. We'll explore how realist inquiry helps interrogate the grand promises of technical solutions, question assumptions about governance and access, and generate grounded participatory approaches to understanding change. From the challenges of working in remote forested regions to the potential for more equity oriented research, this episode asks, what does it mean to do realist evaluation in places where complexity isn't just academic, but it's everyday life? Let's get into it. For that, I have a very special guest with us today, who I'm very excited to have into the podcast, which is Prashanth Srinivas. Prashanth, hello, good afternoon. How are you?
Hi, good afternoon, good evening, Alejandro. I'm so thrilled to be on the podcast with you. Thank you.
No, no worries. Thanks to you. I'm really excited because I know all the work that you're doing at the Institute of Public Health in Bangalore with yourself and all the different colleagues and your journey with Realist. So all of the exciting stuff that has been happening over the last few months. So really want to go into some of the details of your work, through the episode today and in the topic that we are commenting, of course. But just before we go into health systems, ecology, realist evaluation, would you mind just sharing a little bit more about yourself, your background, and what interested you in Realist at the start?
Sure, thank you. Yeah, indeed. I think given the way realist approaches have evolved, who one is and their journey and evolution is very much a part of a choice to make a realist work. So, in my case, I started work as a clinician, a doctor in a community health setting, very much in the same indigenous community settings that you were referring to. I started my work there as a doctor, worked there for about 3 4 years, did a public health master's, and then got fascinated with health systems and health policy research, where the idea is that you look at health within the broader social, political, economic context, that you don't look at health and illness merely as disease phenomena, but as wider social, ecological, political, cultural contexts. So I did a PhD at ITM, in fact, and I think I might be able to stake claim at least to the first health systems research realist evaluation in India, when I used realist evaluation to look at organizational change within government district health managers in southern India from 2011 to 2015. Did my PhD in realist approaches, and ever since I have, yeah, I mean, I must confess that there's a certain charm and elegance to it, of which I'm always trying to be also critical of, so that you don't start saying everything has a realist explanation. So I'm careful and critical about it, but I have sold out to more or less using realist approaches in several variety of health systems and complex health problems that we at the institute work on.
Fantastic, Prashant. And we're exactly going to talk about all those different ideas and evaluations and work that you've been doing. But can I just agree with what you're saying there, that once you think like a realist, it's very hard not to think like a realist. You see everything in configurations and you see everything in complexity, but it's true that it's not a panacea. It's not the only thing that exists to understand the social world, but it's certainly a very useful one. And that is what I say to people as they're considering their toolkit of tools and ways of thinking. That certainly is one that can be useful for newcomers that are coming to the podcast. Hopefully, you find that, and also for seasoned ones that are tuning in into our conversations. You've already mentioned around your work in research evaluation and in realist evaluation in India, indigenous communities, health systems, ecology, and looking at it, from a complexity informed lens, looking at all the different layers that are involved, social, cultural, financial, etc. So what drew you to realist evaluation and to make sense of this complexity? Because there are other frameworks, of course, that do embrace complexity, but what specifically about realist? And where did you first see its value in the research that you do? So within the complex systems and indigenous communities that you do?
Yeah, I mean, look, I think the first actually. realist was not the automatic choice. I first started off with mixed methods. The promise of bringing together, for pragmatic reasons, qualitative and quantitative methods to answer a specific health problem or a health systems problem or a health service problem. So I started off with a course, in fact, in University of Heidelberg on mixed methods, which is still running. It's a very nice course. As part of that mixed methods course, what I felt lacking in the mixed methods approach, which I wonder if some of the mixed method folks will take opposition to what I say. But what I really was looking for is there is not a strong basis for why you will mix and what you will mix. Of course, there's the pragmatism of the research question and the objective that you are working on, which requires you to mix methods. But then, what is it that you're mixing? What if they are not logically, philosophically combining together? And how do you deal with those inconsistencies? I'll give you an example. Um, classic qualitative method. You go and you're interviewing someone, and they're explaining their whole life experience and lived experience, which shapes their view. And you may or may not believe or whatever, but this is their world and they're saying it out to you. And then on the other hand, you are using a psychometric tool and assessing, let's say, a complex psychological construct, perhaps even in the same person whose sort of lived experiences is shaping an in-depth interview on one hand and a structured assessment on the other hand. And then you as a researcher are having to grapple with the fact that the measurement was coming from a very different position and worldview of what a psychological construct is, whereas a lived experience is coming from an entirely different worldview. And we sort of equalize them both as data points, and then we mix and study them. And there's something unwieldy about that, even scientifically speaking. Of course, this is not a realization I had at that time. This is how I make sense of why the realist stuff attracted me, because there's a certain coherence between its underlying philosophy and worldview and the way in which you apply it in real world settings, which captivated me. And I think my first introduction to realist itself was Bruno Marshall's work on why are some hospitals in Ghana doing really well, even though they are working in resource limited settings, whereas others may have been the similar setting but are not achieving similar outcome. And in the classical kind of evaluation approaches, you would look at lot of quantitative indicators and then try to make some hypotheses and explanations. But what Realist allowed Bruno and team to do is to really theorize as to what hospitals in limited resource settings could or could not do. There's a certain explanatory power that realist work has, which allows you to get a systems solution rather than a hospital based solution. So that was very captivating.
Indeed, it's very captivating. And I love hearing you speak around your conversations and thinking on the pillars and the foundations and the philosophical positionings, because those pillars of the approach, and I know you and I are very interested in that, ensure that there's alignment from the very start. There's like a thread to your thinking. And as you mentioned, one of the beauties you could argue of the realist approach is that it's method neutral. So when you're using that interview or that survey or whatever it is, you're using it for the purpose of testing developing theory. Hence, that misalignment, as you say, seems less obvious as long as it's being used from in a realist lens. So that's very interesting, and I completely concur with your thinking that it allows you to go beyond, and that is where I want to go next in your work among Adivasi communities, if I believe that's the right pronunciation. Because I know you've spent a lot of time in rural areas and in indigenous communities. And based on this thinking that you say and on the realist evaluation synthesis that you've done, how has realist inquiry helped you move to go deeper, so beyond the surface level assessments that you may have seen living in these communities, to uncover the deeper structural mechanisms at play?
Sure. No, it's an excellent case. Even when I reflect upon how we use the realist approach in our ongoing work in southern India with various Adivasi communities. Firstly, I must say that a lot of the way in which realist thinking has influenced our work here is not so much in project based approaches. It's not so much about one evaluation project after another, but it's almost inspired a certain way of thinking in terms of work in these communities. Let me explain. So, in 2014 or so, we set up what we today call a learning site, where the idea was, how do you engage with communities in a way where they can also benefit as much as researchers tend to benefit, in terms, it could be in terms of knowledge, it could be in terms of data, etc., in this kind of community work. And this is a really a tension, I think, not only with respect to Adivasi communities, but indeed in global health itself. Right, when you have UK or US academic institutions engaged in large projects in the global south, of course everyone will agree that these should not be extractive, and there's this whole discourse around decolonization and such. That's all fine, but how do you then use methods that allow meaning to be shared, outputs to be shared while they are being shaped? So, in that sense, realist work allows meaning making through shared conversations, open to, for example, participatory workshop. If you look at participatory workshop as a methodology, as you keep working long term with communities, you can in fact have workshops where you share what in the realist world we call middle range theories, and allow them to be shaped, refined, and challenged by communities. Because after all, if we as researchers are going to create theories about communities and their experiences, I think they have a very important stake in being able to shape, reject if needed, refine if needed, and shape these kind of theories. So, our approach to using realist in the context of Adivasi communities was, how do you engage in a theorizing approach that's not merely intellectual, but also potentially co-production friendly, something that allows sort of knowledge or meaning making in wider settings than only in research seminars, etc. And as a consequence, we have not really used realist evaluation as a project, but rather we have used it, the idea that our work needs to eventually come out with middle range theories. We don't call it that in our work. In fact, we say that together our research team and communities are really looking for explanation as to why things are the way they are. And isn't that really a middle range theory? It because it helps us identify patterns of co-occurrences, and then it asks the researcher to create a powerful explanation which can stand to test on why things are the way they are. And our question in the context of Adivasi communities is, why things are like this? Is it probably much more than illiteracy, remote location, etc., which are often given as surface level explanations? Oh, they're far away. Oh, they're living in a remote area, and that's the reason health is poor. No, living in a remote area is an insufficient explanation for why somebody's health is poor. Being culturally different is a very poor explanation for why health inequalities exist. So, realist approach pushes us beyond these easy explanations that are abound to create very grounded kind of explanations which can be co-produced with communities. So yeah, so that's what I think we figured.
No, some very interesting thoughts. Thanks, Prashant. And I want to just comment on a couple of those slightly, because you mentioned around the methods, and again, a little bit, as you mentioned earlier, about the alignment in your philosophy and way of seeing the world and way of understanding knowledge, but also the methods that you use have to be in alignment with the meaning making that you want to create, particularly if you're working with people, for people, and not at people. And I think that's quite important in global health, and particularly, as you're saying, when you're getting involved so deeply in the communities that you mentioned. And I love the way that you're explaining, yeah, middle range theories with explanations, and using that language of accessibility and making this sometimes complex ideas very accessible. And I think people are starting to do that quite often in realist work, that they're getting this complex ideas and trying to try and explain them in a way that is useful. But just for those who may not have come across this term before, would you be happy to explain what a middle range theory is? And
Mm.
how did you, in the workshops with the communities that you lived in and that you co-produce this knowledge with. How did you come to that middle range theory? So what is it, and how did you do it to get to that level with the communities that you work with?
Sure. I think one of important for me at least, one of the important social science advancements has been the idea, the concept of theories in the middle range, right? So, what do we mean by this? We can think of theories as being powerful explanations, and the big theories that we often hear about almost seek to explain all phenomena around the world in one kind of coherent way. And whereas I think as the social sciences have advanced, multiple schools hold that in the complex human societies that we work in, we will probably never be able to explain all social action in one grand theory. So instead, I think, how do we then advance our inquiry into society? We advance our inquiry through carefully empirically discovering or explaining the patterns we see using middle range theories. What are these theories? These are middle range theories are those which tend to apply in many similar settings, many settings that are probably possible across geographical contexts. So it could be middle range theory, for example, that explains what kind of organizations of let's say what kind of small organizations foster team based leadership as opposed to dictatorial or a kind of single charismatic leadership. If for example our quest is for organizations that are thriving and that are team oriented, that are bringing in people together, so one could look at discovering a middle range theory that explains across many such organizations around the world, but it will never be able to be something that can explain every single organization of that kind. So that's how I think I would explain middle range theories. And in our work in communities, I would not be so bold as to say that we have now discovered many middle range theories. That what I would say is that in 10 years of work, we have begun to uncover various powerful explanations on what are, for example, the limits to social action from marginalized communities. For me, the answer to that question, we haven't really published these things as theories. And that's where I want to explain a little bit on how the realist work works for us. For us, the realist approach is a way of working in the site. We don't use the realist approach anymore to create some kind of grand middle range theories. It's an approach that helps all of us engage with creating explanations that are co produced, that both our community leaders and us together are advancing in our knowledge of what works and what doesn't. And it helps us move forward, in fact, because over time, together we are all community stakeholders, researchers are together beginning to see the limitations of what health programs can do, the limitations of what activism can achieve, the limitations of leadership in social movements among marginalized communities. It's extremely difficult to sustain those kind of leadership. So a lot of this, I think, would be in the domain of what perhaps non-realists would call practitioner-based wisdom. But I think what realist approach allows us is to go deeper into practitioner-based wisdom and make some simple rules out of it. And what's likely to work? And that's how I think realist approach allows us to navigate complexity and unpredictability. It allows you to create probable simple rules which can help us navigate real complex scenarios. It can help us become more wise about why we do what we do. Yeah, so that's, I mean, I can go on and on. I think I must stop, but that's how we look at it.
No, no, brilliant. Thanks, Prashant. And some really interesting nuggets that you picked up there. I really liked your explanation of middle range theory as well. I sometimes, when I describe it as well, I tend to think about it like Goldilocks. So those may know the story of Goldilocks, and you know that when she went to eat her porridge, it wasn't not too hot, not too cold, but just right. So not too hot, i.e., that it's just this substantive grand theory that it's all like a panacea of the world, or also not too cold, that is just so granular in your data that it just sits just about right. So I think you did a great job at explaining that and that theoretical generalization, and also just I guess, a point of of for PhD students that you said that in 10 years of work, this is when you really started seeing some of the really useful explanations and really useful things coming up. So with those people starting with a realist journeys or realist work, you're not going to have the final answers like straight away. It's not going to be like your theory is going to be perfect and everything. Actually, through the iterative refinement over the years, that's where you get some of the most value as well. And not to say that one project can give you useful information, of course, but I think that it's also reassuring to see that it's an iterative process that can evolve as well.
No, I want to take that up actually, because that's often given as a criticism, right? Oh, you guys say realist stuff is very resource intensive. Oh, it will take years, and oh, it might take 5 years to get to, or it might take so many sites and iterations to actually get to a meaningful. All of that is true. But on the other hand, it's better than having a bunch of tools which give you some quick bites or looks into your field. Yeah, which all don't come together. And then everyone will do, I don't know, some stakeholder interviews or just qualitative inquiry or quantitative inquiry and say, oh, everything is complex, this kind of thing. So I think the realist promise is that it creates investing in realist approach, I would say, builds a certain kind of wisdom over time. It builds a certain humility in what is possible and what is not possible. And I think that's why realist has not probably become super popular in the evaluation industry, because it's not a fix for every problem. But on the other hand, it's a great insight, great approach to build insight, not only among in the evaluator, but among various stakeholders that the evaluation approach will work with. So there's many promises to it, but on the other hand, yes, resource intensive, time intensive, but that is how social change is. If someone else, it's not a problem of realist evaluation that it takes time. That's what social change, social transformation is like, right?
It absolutely is. It kind of mirrors the social complexity that we have in the world. That it's not a quick fix. Certainly, there's like this snowball effect that comes with it. And I really like what you said as well about that it's quite humbling. Just knowing that knowledge is fallible. We can be wrong and partial. That our explanations are never the final answer of this reality that is out there that we're trying to perceive. So that is really interesting. And I guess that this reality that's out there becomes even more interesting in some of the contexts and settings that you've been involved in, such as remote forested settings, which do bring unique opportunities and challenges. Individuals who are working, not just in their lab or in their office, but they're actually going into the communities that they're working in. And as you mentioned really elegantly and very nicely, this realist thinking and this realist way of seeing the world into their work. So, what have been some of the biggest insights that have emerged from this long term engagement in working in this remote community? Some of the key ideas or key learnings of trying to apply realist approaches or realist thinking in remote forested settings for working with indigenous communities.
One key learning has been that realist approaches, if you remove all the scientific jargon, at the heart of it, there's a certain simplicity which is appealing to anyone, irrespective of their educational attainment, etc. And you need these kind of approaches when you're working in most real world settings. It's not only about indigenous people, right? It's at least in India, in many rural and underserved communities, you would need people to get excited about research in a way that is relevant to their daily lives. You cannot, for example, I cannot go and say that, look, we're going to do research now. It involves a large survey. We collect a lot of data. And then after 3 years, we are going to tell you what predicts maternal mortality in your community. And then it can be a project saying predictors of maternal mortality in XYZ communities. That sounds like something exciting for you guys. And you should do that. But right now, we have mothers dying. We have that issue. We don't have running water, etc. So how do you then begin participatory engagement on a long term and bring the promise of research and knowledge to communities who are struggling? And for me, there is a real integration there between participatory action research and realist approaches, because like I said, when we started this town hall style annual health dialogue, where about 200 indigenous community leaders from multiple parts of our district gather, at the heart of that was actually, I would say, a realist framed question. It is, why are things the way they are here, but they are very different elsewhere, right? Outside your forest, things are in another manner. Health inequalities are very different. Why are they so problematic here? And if you say that that is a question that interests us researchers, we want to build a theory about it. People are also interested in it. They are also very interested in that explanation, and they have their own explanations already, because these are people who have been involved in activism. This is not a new question for them. They have been grappling with it for years. So there's a lot of wisdom there as well. There's a lot of lay explanations, lay knowledge, oral traditions, etc. So then here you have an approach that allows participatory platform building. It allows the research team to theorize, not at the cost of having an extractive enterprise. It has the potential for theorizing together. So I think this has been an amazing learning. However, like I said, if you ask me, okay, what are all the theories you generated? I don't think that's a useful question. We have not bothered sort of saying, okay, these are the theories generated. But in these 10 years, what we have created is multiple Adivasi youth who are part of our research team, who are able to give you what would sound like reasonably well articulated initial program theories of why things are the way they are. And in the long term, you can have people who are from in the next 5 years, we hope that we will have researchers asking these kind of questions who grew up there, about my own people and my own community, probably bringing up their own theories grounded in their own lived experience to explain to others like me who came there why things are the way they are. So that's really the promise for me of realist and participatory coming together.
What a lovely description, Prashant, of just showing the power of realists beyond citations or beyond mm, papers or beyond the academic style that you always kind of have this association with in academia. And this goes beyond realists as well. It's just how, as researchers, we're also making impact beyond all those metrics and beyond that to the people that we are trying to serve at the end of the day, and we're trying to help with our research. And it's so valuable to hear the work you're doing to upskill individuals again. And it doesn't seem like it's not an upskilling sense of they didn't have these skills, but it's just doing these skills in a slightly different way. As you say, these people, these individuals already have as
Yes.
humans, we're constantly thinking and explaining why, how, in what context. Like, we're constantly doing that, just not in an elegant, CMO configuration. So
Yep.
actually giving them
True.
that understanding and those ideas, I think that's fascinating. And I love the mix of both. And I think, I'm not sure if you've seen much around realist ripple effects mapping, for example, and this kind of work and approaches are becoming also quite valuable. And one of the things that you mentioned for me that is so important, that it's not a transaction. So it's not a transaction of knowledge, or we're going to, like, suck all this information from you and then that's it. Actually, we're at the same level here. Kind of show me, I'll show you yours if you show me mine, and that kind of teacher
Yes.
learner cycle, which again, I completely agree that it makes realist and very attractive in that sense.
Absolutely. No, if you there's no other way. If you look at frameworks like resilience, the idea of building resilience, the idea of building long-term, connections. These, I mean, all of the resilience work tells us it's ultimately something about human relationships beyond financial transactions and incentives and such, which have a certain sustainability over time. And we need in days of all of the climate change and all of these kind of problems, you need knowledge approaches which bring people together, which, I mean, it may sound like too grand an enterprise that realist will do that, but what I really want to say is, in the kind of problems we face today, especially in the area of health inequalities, in any setting, it's not only about indigenous people. In any setting, it could be in the UK, it could be in Latin America, it could be in Africa, wherever there are inequalities, and they're everywhere, you will need researchers to be able to comfortably engage in a scientific enterprise that acknowledges this and builds solutions above it. We cannot just keep studying inequalities as if there is some advanced scientific stuff that we will do in the university which will give us an answer. You have to figure it out there, and that's what realist allows if we wield it in that way. Realist approach can also be done in a classic university style, and there's not a problem with that. That's also one kind of inquiry. But realist work can also be done in this way, in deeply participatory and emancipatory kind of way.
Absolutely, Prashant. And I think, as you say, it's in the big world and in the big complex understanding of the social world and health inequalities, global health research. I think that it's important that we try and get as much knowledge and information from not only from the work that we do, but from other people, and getting them in collaboration to really get to that stage. And that actually links really nicely to one of the other questions that I was thinking for you, because with all the 10 years that you've been working with these communities, but more and in more projects and settings and contexts. I guess it's now looking ahead. So you say this health inequalities that unfortunately all trajectories appear that they're not going to get any better, particularly in the next few years. And, all this gap, even though I always find fascinating that even though in the world of today, where you think around medical developments and you think about life expectancy and stuff, and in many ways we are in one of the best times in history, but at the same time, the gaps keep increasing. So it seems like a very interesting conversation, and I guess that the realist approaches in its slogan, "How, why, for whom, and in what context," can give us some answers to this. Not all, but some very useful ones. So looking ahead in your work and in global health inequality and in all this field, how can realist approaches contribute to more grounded, participatory, equity-oriented health systems research? What is it that you see the field moving forward? What are the goals that it should strive for in the next 5, 10, 15 years?
Yeah. Thanks. I mean, let me just use an example of the current crisis. I don't think we should also be too currentish about this question, because this kind of a question spans a larger time, decades. And often I see in many historians talk about this. Often our lens is so short termish, and we're too conditioned by seeing things in the days, months, weeks frame. And if you suddenly pan out and look at things from decades, it's a little more humbling. It's a little more settling. It's even a bit more calming, at least for me. So if you look at it from that sense, and if you take the current scenario, such as the USAID pulling out of, one is to look at it as a sudden problem. Oh, it's USAID and it's one government which has done this. It's unfair, etc. But the wider problem here is donor dependence. It's the fact that we had built a system that was so fragile to begin with, that the decision of one country's funding agency can impact thousands of people. So I think the promise of realist work is to say that there is never going to be this kind of a grand theory, this kind of a grand model in global health, or this amazing project which we put 10 million pounds and do this, best people come together and they give us the final solution. There isn't. That's what realist and the complexity aware approaches tell us. And I think with more, it tells global health to be more humble and to look for program theories and small middle range theories, things that work in, and not look at scale, to not get carried away by the kind of scales that large global health corporations look for. I think those are driven largely either by naivety or by some kind of commercial interest. I cannot see science in trying to find that kind of global solutions to many of the problems that we face today. We need more humble approaches. You build those approaches together, slowly scale and understand and build wisdom in the systems. You don't build dependence on a project to liberate people, but you build resilience. You engage in global health projects and collaborations that leave behind knowledge and reduce dependence on anyone else. I think applied in that way, the realist approach has a lot of lessons for global health.
I love that, Prashant. Thank you so much. And I think that the things that you mentioned around being humble, going step by step, and understanding that complexity of the social world gets answers by using complexity and not trying to necessarily simplify that, then that becomes a really interesting approach. And I think that it's fascinating to see how in the world of realists there is so much room as well for innovation, for developments, for areas in all fields. But in global health and health inequality, I can see so much potential, which already it's being done. But I'm sure that there's a lot of different individuals coming along as well in that journey. And look, Prashant, I've really enjoyed our conversation, hearing more around your thoughts, your journey, your ideas, your work, and particularly how you speak about realists is very refreshing as a way of thinking, as a way of providing people with just in a way, I think everyone thinks like a realist. It's just they probably not know it yet, and it's an opportunity to help them get into that level. But after all your time, and after all the skills, and after all the people you've met, and all the realist work you've done, what would be for individuals who are interested in a similar field, so participatory approaches in realist, or realist in global health, realist in health inequality, for those individuals who are either PhD students doing their PhDs or researchers who are interested in this field, what are your top three tips from everything that you've gone through? The top three things. I know it's hard asking for three. I'm sure you could give many, many, many. But if you had to think of three, what would they be?
One is, I think, form teams and coalitions as opposed to looking out for one amazing professor or one amazing expert in the discipline, rather looking at building a small peer group which can help you. It could be with grant writing on realist or other stuff, it could be with papers, analysis, etc. I have found peers and peer networks much more helpful than some amazing professor far away who's going to completely solve your issue. So that's one. Build peers, coalitions, networks in your own setting. Two, and this is a little bit of a tough one, the realist and the kind of work you want to do is not going to get you funding. Do what is ethically okay to get the funding anyway, and but on the other hand, use the insights you obtain from this kind of social science inquiry, from the realist and realism approaches, and slowly show people that you can do more with less conventional methods, because often the funding landscape is so rigged in favor of safety and low risk for the funder than about what needs to be done. So early career researchers, sometimes you'll have to figure out how to ensure that you sneak in realist work without necessarily saying the whole stuff is going to be about generating some middle range theory, and then you have a reviewer thinking, oh, what theory will come, etc. Maybe a last one is, given that realist evaluation in health systems at least is still a refining field, it's okay to make mistakes. I look at my own papers from a decade back, and I sometimes say oops. As a reviewer, I'm often saying, this is bad. Have Yes, it is published in a scientific journal, etc., etc., but it's a field that's evolving in its how to practice it. So there isn't really one way of doing stuff. You'll have to be okay with making mistakes, putting yourself out for review out there on relatively safe groups like Rameses and such, where people are very kind in the way they give feedback most often. So it's okay to make mistakes, and because it's not a randomized controlled trial kind of a design where everything is really well laid out. So maybe I'll stop at these three. I would have found these tips useful to myself in 2011.
Well, fantastic. And just to summarize those, number one, form coalitions and peer groups in your area. Number two, slowly show the value of realist work and try and get that funding, of course. And number three, it is okay to make mistakes. And I love that because in the process of realist, there's no one way to do it, and there's so much room for innovation and development. I'm sure there will be mistakes, and mistakes are just part of learning and to improving your work. Prashant, it's been an absolute pleasure to have you in the Realist Lens. Thank you so much for your time, for your thoughts, for your conversations. And for anyone listening to the Realist Lens today, thank you so much for your time as well. And I'll speak to you soon. Thank you so much.
Thank you for what you do with the realist lens and made go places.
Thank you so much.
Okay.